So psoriasis and psoriatic arthritis can coexist. Usually one aspect develops before the other. So sometimes you have the arthritis and the stiffness before you develop the skin disease or the psoriasis. And sometimes you have the psoriasis for many years, and then you can develop the arthritis or the joint stiffness later on. Psoriatic disease can involve the skin, which is a psoriatic rash, which is a red rash that can be over the knuckles or the bony prominences like the elbows or the knees. But psoriatic disease can also involve the joints. So it can be arthritis or tendon inflammation, dactylitis, which is swelling of a finger or a toe, or it can be spine involvement. So psoriatic disease can be all those things. So when we're treating psoriatic arthritis, we have different options of medications that we can use. But if the arthritis is more severe, especially if it's causing damage to the joints, then we want to give something more protective. And those more protective medications are called disease-modifying anti-rheumatic drugs, so DMARDs. And so a DMARD helps to prevent damage to the joints. So leflunomide or methotrexate are DMARDs that can treat both the skin disease, the psoriasis, and the psoriatic arthritis. So biologics are more modern kinds of medications, and rather than affecting the entire immune system, biologics work on certain cytokines, certain small molecules that cause inflammation in the blood, so they're much more targeted. So the biologics that we use to treat psoriatic arthritis, the most common ones are TNF inhibitors. And those are the ones that can treat both the psoriasis and the psoriatic arthritis, both parts of it. And JAK inhibitors are newer medications which block something called Janus kinase. So it works a little bit differently and reduces cytokines just through a slightly different pathway. And so JAK inhibitors are actually now known to be very effective for treating both arthritis, psoriatic arthritis, and psoriasis. So it can be very helpful to treat all those things. If you've been diagnosed with psoriatic arthritis, you really need to see your doctor on a regular basis and let them know how you're doing with the different treatments that are being tried. Often we can't predict in advance exactly what medication you're going to respond to, so we need to see how you do on the medication. With the treatments we have available now, usually we can get you to having no inflammation, and that should really help you get back to a normal life and normal activities.